You may have already heard about ovarian reserve, perhaps during an appointment with your gynecologist or fertility specialist, or maybe you came across the term online. But what does it actually mean? Put simply, ovarian reserve is the number of eggs in the ovaries. That's a good definition to understand the basic idea, but in reality, it's a little more complicated. To fully understand ovarian reserve, we first need to look at where this supply of eggs comes from. In fact, it develops before birth. Every girl is born with a certain number of eggs. At birth, the ovaries contain about 1 to 2 million immature eggs. By the time puberty begins, that number has fallen to around 300,000 to 500,000. After birth, no new eggs are produced. From that point on, this supply only decreases over time. So, what happens to this supply? Each month, the body begins preparing several eggs. Usually, only one fully matures and is released from the ovary. It is then capable of being fertilized. This process is called ovulation. Sometimes, however, 2 eggs mature and are released during the same cycle. So, ovulation isn't always limited to just 1 egg. What happens to the rest? Although several eggs begin developing during each menstrual cycle, usually only one reaches ovulation and can be fertilized. The others stop developing and gradually disappear. That's why, over the course of a woman's lifetime, there are only a few hundred ovulations, even though the original supply of eggs was much larger. Earlier, we said that ovarian reserve is simply the number of eggs remaining in the ovaries, but that's only part of the picture. The number of eggs and ovarian reserve are not exactly the same thing. So, what is ovarian reserve? If we simplify it, ovarian reserve really is the number of eggs remaining in the ovaries. But for a doctor, that definition isn't enough. In reality, ovarian reserve is understood more broadly. In medicine, ovarian reserve is a concept used to assess the reproductive potential of the ovaries. It takes into account not only the estimated number of eggs remaining, but also their ability to mature and contribute to a pregnancy. Simply put, the number of eggs is the biological foundation of ovarian reserve, but it is not the whole of ovarian reserve. Ovarian reserve is a medical concept built on that foundation, but it cannot be reduced to the number of eggs alone. So, isn't the number of eggs the most important factor? It's important, but it's not the only one. In fact, it's not even the most reliable one. Trying to count eggs is essentially pointless. It's impossible to see every egg. It's impossible to know in advance which ones will continue to develop, and it's impossible to determine which ones will ultimately be viable. A higher number of eggs does not mean a higher chance of conception. That's why it's much more important to understand the overall reproductive potential that the ovaries still have. And even that is only one of many factors that influence the likelihood of pregnancy. Ovarian reserve is important, but so are a woman's age, egg quality, the condition of the uterus and fallopian tubes, and many other factors. So, when a doctor talks about ovarian reserve, they are not referring to the exact number of eggs remaining, and certainly not to how many pregnancies a woman has left. Ovarian reserve is a way of assessing the overall reproductive potential of the ovaries. It's an important measure, but far from the only one. There's one more thing that's important to understand. After birth, the supply of eggs cannot be replenished. We can't change how many eggs remain, but that doesn't mean we can't influence the chances of pregnancy. In many cases, we can. We can address factors that affect reproductive function. For example, by improving lifestyle, treating certain medical conditions, or correcting other factors that reduce the chances of conception. The key point to remember is this: ovarian reserve is neither a guarantee nor a verdict. A good ovarian reserve does not guarantee pregnancy, and a low ovarian reserve does not mean pregnancy is impossible. It helps a doctor assess one important aspect of reproductive function, but by itself, it cannot determine whether pregnancy will occur. That's why you can't judge your chances based on ovarian reserve alone. There are many other important factors, and the whole picture always needs to be considered.